Hello everyone, so my name is Jason Sims and we are going to do a quick video on the drug chloroquine. So basically, the drug chloroquine has a few uses, but the main use is going to be in the treatment of malaria. Now, the organism, the parasite that is causing malaria is called Plasmodium, and there are different species of Plasmodium. Now, so let's get right into this. So the uses of chloroquine, it can be used as a prophylaxis or it can be used as a treatment. Now though, there are certain strains of Plasmodium, of malaria, that cannot be treated or be used as a prophylaxis for chloroquine. And those strains specifically is going to be Plasmodium falciparum. That's going to be the main one that chloroquine is not going to work on. Then there's two other strains. It's going to be P. ovale and P. vivax. The reason why those two strains are not going to work with chloroquine is because those forms when the parasite, Plasmodium, infects the host, the person that got infected, the parasite will become inactive, will become something called latent in the liver cells. Now, chloroquine will not act on Plasmodium when it is latent, when it is inactivated and just dormant in the liver cells. It will only work when Plasmodium is in the bloodstream. Now, chloroquine does have some other uses that aren't the main focus, but I think they should be mentioned. One is for amoebiasis, and the other is for rheumatologic autoimmune conditions. And that could be like lupus or rheumatoid arthritis, or some other ones too. Like any drug, there are adverse and side effects caused from the drug. Some of the main ones that we need to know about is one, it can cause retinopathy, which is like disorders of the eye. Now, the reason why this happens is chloroquine, the drug, it will deposit in tissues all over the body. Now, specifically, there are cells called melanocytes. Those are found all over the body, but they're also found in the eye. And what happens is chloroquine will deposit in the melanocytes, and that will cause visual disturbances. It will cause vision problems. Now, another issue that can happen is alopecia, which basically means hair loss. Okay, the last adverse effect that I want to cover is it can cause QT interval prolongation. And basically, talking about EKG is just causing like an abnormality on EKG, and we're not going to get too much into the specifics of that. So chloroquine can be used as a prophylaxis, or in this case, we could call it a chemoprophylaxis. And the way how this drug is given is PO, per oral, only by mouth. It's not usually given by IV because of the toxicities that can occur. Now, if we're going to be taking this as a prophylaxis, we are going to be wanting to start this drug 2 weeks before the exposure to malaria, Plasmodium, and we want to continue this drug for 4 weeks after we are done with the exposure of the malaria, of the Plasmodium, and basically we are going to be taking this drug 1 time a week. Now though, say you have Plasmodium, say you have malaria, and this isn't going to be one of the P. falciparum, and it's not going to be P. vivax or P. ovale, but it's just going to be one of the other species of malaria. And we want to treat it with this drug, with chloroquine. Okay, so what are we going to be doing? So we're going to start off with 1 loading dose. It's going to be a larger dose than the normal. And then after that, we're going to give 3 subsequent other doses that are going to be about half of the loading dose, and that's going to be over the next 48 hours. What about if you have a kidney problem or liver problem? Right now, there are no recommendations for adjustments of the dosing for liver or kidney impairment. And similarly, if you are pregnant, there are no contraindications for that too. So chloroquine has an interesting MOA, an interesting mechanism of action. Basically what happens normally is the parasite, it will bring in host hemoglobin into itself, into the parasite, and that's called phagocytosing. Basically what happens is the parasite, the Plasmodium, will break down the hemoglobin for its amino acids, and what is left over is going to be heme. Now, to the parasite, to the Plasmodium, heme is actually considered toxic, so the parasite is going to want to get rid of this and further break down the heme. Okay, So now where does chloroquine come in? Chloroquine will increase the pH of the vacuole that's containing the hemoglobin, which the parasite uses to bring the hemoglobin in, and by increasing the pH, this disrupts the progress, disrupts the metabolism of heme to hemozoin, which is not toxic, but heme is toxic. So if we are disrupting this process, we're going to have more heme, less hemozoin. Heme is toxic, hemozoin is not toxic, but we're going to have more heme, and basically this is going to be deadly to the parasite. And that is the general idea currently of how chloroquine works to defeat malaria. Alright, I really hope this was informative. If you liked this video, please like it, please subscribe, and I'm going to do my best to keep making more videos like this that are nice and quick and educational. See ya!